During pregnancy, anal sex can be a confusing and sensitive topic for many couples. But there are clear medical guidelines available. First and foremost, every pregnancy is different. So it is essential to consult a doctor or gynecologist before engaging in any form of sexual activity, especially anal sex. If the pregnancy is progressing normally and there are no medical complications such as bleeding, placenta previa, or risk of preterm labor, then anal sex is not strictly prohibited. However, it should always be done with extreme caution, proper hygiene, and mutual consent. The anal area naturally contains bacteria, and if cleanliness is not maintained, there is a higher risk of infections. Both partners should be clean, and it is especially important to avoid vaginal sex immediately after anal sex to prevent the transfer of bacteria into the vaginal tract. Using a water-based lubricant is absolutely necessary, as the anal passage does not produce its own lubrication. Without proper lubrication, anal sex can cause tearing, pain, and even bleeding, leading to increased risk of infection. Therefore, applying a generous amount of lubricant is highly recommended. The position should also be considered carefully. Pregnant women may be more comfortable in side-lying or spooning positions, where there's less pressure on the belly and the body remains relaxed. Movements should always be gentle and slow. Any sudden or rough action can cause discomfort or injury. A common question is whether ejaculating semen inside the anus during pregnancy is safe. Medically, it is not recommended. Semen contains prostaglandins, which in some cases may trigger uterine contractions. While this is more of a concern with vaginal contact, if semen leaks toward the vaginal area, there may be a risk of preterm labor, especially in late pregnancy. Furthermore, semen left inside the anus creates a moist environment, which can encourage bacterial growth, irritation, and increase the risk of infections. If the woman already has hemorrhoids, which are common in pregnancy, semen inside the rectum can worsen the irritation and swelling. For safety, it is best to ejaculate externally rather than inside the anus. If there is any pain, unusual bleeding, or abnormal discharge during or after anal sex, the activity should be stopped immediately and a doctor should be consulted. Emotional comfort and mutual consent are just as important as physical safety. Open communication, respect for each other's boundaries, and being attentive to the pregnant partner's feelings are crucial for a healthy sexual relationship. In summary, anal sex during pregnancy may be considered safe if the woman is healthy and there are no medical restrictions from her doctor, but it must be practiced with proper hygiene, lubrication, gentle movement, and without ejaculating inside the anus. The safety of the mother and baby should always be the top priority, and nothing should compromise that.